What does the evidence say about navigating the transition of perimenopause? Number one, prioritize protein and resistance training together. Preserving muscle mass during perimenopause is not optional. It is the single most impactful thing most women can do in their long-term metabolic health. This requires two things working together: adequate protein intake and progressive resistance training. The research on protein needs in midlife women consistently points towards higher than general recommendations. Most evidence supports aiming for 1 to 1.6 grams of protein per kilogram of body weight. And resistance training, lifting weights, using resistance bands, body weight training, that provides the stimulus that the muscle needs to respond to that protein so that it can maintain itself or grow. Then addressing insulin resistance directly. Reduce the refined carbohydrates, added sugars, prioritize fiber, manage your meal timings, and get regular movement throughout the day. For some women, medications like metformin or GLP-1 receptor agonists may be appropriate, particularly when you see the rising A1C and also weight-related metabolic risks like increasing cholesterol. This is a conversation worth having with a physician who understands the metabolic picture of menopause. Screen for cardiovascular disease, especially if there's a family history of sudden cardiac death, heart attacks, heart disease requiring stents or bypass surgery. Talk about cerebrovascular disease, family history of stroke, dementia. Take sleep seriously as a medical priority. Sleep is not just a variable of your lifestyle. It is a physiological requirement with metabolic consequences. So if you're sleeping poorly, that deserves real attention. Sleep hygiene, optimization of your sleep, evaluation for sleep apnea if indicated, which becomes more common in women post-menopause, consideration of hormonal treatment, hormone therapy, and addressing the root causes. The evidence on hormone therapy has evolved. The menopausal hormone therapy has been the subject of enormous confusion since the Women's Health Initiative study in 2002 that generated the widespread fear and confusion among the physicians as well as the patients. The evidence has since been significantly reanalyzed and recontextualized. For healthy women without specific contraindications, hormone therapy initiated during perimenopause or early menopause, the so-called timing or healthy cell hypothesis, appears to offer meaningful cardiovascular and metabolic protection, in addition to the relief from the bothersome symptoms. It is not right for everyone, but for many women, it is an evidence-based option that has been unnecessarily withheld. So this is a conversation that deserves nuanced discussion, individualized therapy, and a physician who is up to date on the current evidence and not the one who is still practicing based on 2002 headlines. Monitor your metabolic markers proactively. I have a handout on my website for what labs to check for. Ask your physician about comprehensive metabolic evaluation like fasting insulin, full lipid panel, inflammatory markers like high sensitivity CRP, thyroid function, vitamin D, B12 levels. These baselines matter, both for what they show now and for tracking changes over time. Take charge of your health and talk to your physician about getting a baseline and then tracking it over time. Please go to my website for this handout on what labs to get during perimenopause, and I hope it's helpful. Thank you.